All right. Hello. Happy Monday. I want to talk about something that's very important, and that is, what is it? Nonsense that people hear about online. There is so much nonsense. You guys have heard me talk about filler migration, how it's not a thing, fillers don't migrate, blah, blah, blah. We have a video on it. We've talked about how fillers overfill, they spill over to the next level, but they don't get up and move and migrate, so that doesn't happen. Today, I found out that there is all this scare going around because celebrities are stepping away from Botox and taping their face. Now listen, first of all, please, celebrities should be acting, entertaining us, making their videos and music and whatever, but not advising us on cosmetic surgery because let's be honest, how many of them look really, really good? And even the ones that look good, they're not doctors, they're not nurse injectors, they're not nurse practitioners, they're not dermatologists. So let's keep things in perspective. So what's the newest rumor? That Botox creates toxicity. They get Botox toxicity. Total nonsense. Botox was FDA approved in 1989. In drug terms, that's an extremely long period of time. In fact, Botox is safer than Tylenol or ibuprofen or aspirin. And every one of you has taken those medications for a headache or an ache or pain or something. So do not be afraid of Botox. Now, it's got to be done the right way. If you do it the wrong way, you'll create all sorts of weirdness, but that's just a tool. It's a hammer. If you use a hammer incorrectly, you'll damage things. But a hammer by itself, when used properly, does the job. So in this situation, we're doing masseter Botox. What's the risk of the two major risks of masseter Botox? One is, if you do the injection and slide a little bit too forward, anterior medial, you'll get some of the smile muscles that move the corner of the mouth. So if you get a crooked smile and look like you have a stroke or Bell's palsy, is because the Botox was injected a little bit too far forward, number one. Number two, if you do Botox and diffuse it through the muscle, it's a large muscle in that area, it's kind of a round, like thick muscle there. We try to separate it, put like a bunch of pokes to get most of the muscle injected. But sometimes after a couple weeks goes by, the entire muscle may not be fully relaxed and you may get like a couple of little spots of the muscle that are still flexing and kind of bulging. That's not a big deal. Go back to your injector, put a couple of extra drops in those, and you're done. The same thing as platysmal. You may do platysmal bands, and like a little bit of it may not fully take, so you go back and get a little bit more done. Not a big deal. So people that are out there either scared of Botox toxicity or scaring people of Botox toxicity, stop it, please. So now let's watch how we do this. Here we have a patient, lovely patient, who's one of our staff. You've seen her in injection videos before. So today we're going to do masseters. She does them for grinding, for slimming a little bit too, right? A little bit of slimming, but mostly, yeah, mostly for grinding. It does a wonderful job. What we're going to do is we're going to take a little alcohol, prep the area. For Botox, you don't need to take and go crazy with the alcohol. For fillers, I like the area completely clean of any makeup, lotion, etc. because the filler lasts there for a long time. So we're going to start on this side, which you can see better. So turn your head this way for me. I'll put my finger here, bite. So this is right where the masseter muscle is. It's coming down, wrapping around over here. So that's the masseter. If you do the injections out here, you're going to create the smile crookedness. But if you do it over here, you're not. Is my finger blocking the video of you? Yes or no? You're good?
It's good.
Good, perfect. So diffusely putting it through the muscle a little bit. The injections are deep, down to the muscle. And then after I do it, just a little light massage, and I tell the patients for a few minutes on their way as they're walking to their car, just do a little bit of that. That's it. Now, let's go around the other side, walk around here. And face this way. Yep, you want to hold it. Sure. Cool. All right. So on this side, same thing. Bite. You see the muscle is right in this area. Masseter muscle. It's Botox to the masseter. Now you can do Botox. You can do Dysport. You can do Daxify. There's a whole bunch of them. Zomen, Jeuveau, blah blah blah. We stick with the name brands, the big ones. We basically offer Botox and Dysport and Daxify. There are some kind of grade B ones out there. We like to stick with grade A, USDA grade A, right? The good stuff, which is Botox, Dysport, and Daxify. I'll take that from you. Cool. no pain, no bruising, done. So don't be afraid of Botox, boys and girls. If it's done properly, it's perfectly fine.